have a bolder national conversation about the trade-offs we now make with COVID. The disease is still with us. The suffering for many in the first half of the year will not easily be forgotten. But for how long are we prepared to go through a life of rules and restrictions? How stringent should the measures be to control the virus if those measures cause damage in other ways? Joining us now, Christina Pagel, Director of the Clinical Operational Research Unit at UCL, member of Alternative SAGE, and Sunetra Gupta, Professor of Theoretical Epidemiology at Oxford University. Nice to have you both. Christina, let me start with you. Do you think we are having a bold enough conversation, taking into account the risks on both sides in terms of the strategy we've chosen?
I mean, I'm not sure we're having a conversation at all. I mean, there hasn't been a new government strategy. I mean, the last thing they published was these alert levels in June, and currently, according to that, we should be in lockdown. And we haven't heard anything since. As far as I'm concerned, we have seen that really good contact tracing can let you have a reasonably normal life. Currently, with the testing system the way it is, we can't have that.
So let me ask Sunetra the same question. Does the conversation need to broaden, or are we happy to basically go along with what we're doing now? Groups of 6, track and trace, not actually knowing for how long these limitations and restrictions are going to be put on our lives?
No, I don't think. Well, I'm certainly not happy. And I think there needs to be a fundamental change in how we approach dealing with this crisis. Because at the moment there is a single narrative, which is to be in control of the virus, which doesn't, to my mind, really respect the fundamental dynamics of a pathogen like COVID, which is that it will be with us, that normally such pathogens are controlled by some form of collective resistance, collective immunity. I'm avoiding calling it herd immunity for obvious reasons, that builds up in the population. And one can rely on vaccination to do that, but that's something that would require us to wait.
Sunetra, can I just go back on that, because it's interesting that you say you're avoiding calling it herd immunity for obvious reasons. It was mentioned, I think in that phrase, by Patrick Vallance in March. The government denied that was ever the goal, but it does now seem to have become the most toxic phrase ever. And I wonder if you think that that should have been or should be given more consideration as a way forward.
Well, to me, it's quite inexplicable why herd immunity has become a toxic phrase. Herd immunity is a natural phenomenon that ensues from the infection of a population by an infectious disease agent. And that is what normally and naturally brings it under control and reduces the risk to a level where people who are vulnerable to death from that infection can resume normal lives.
So let me ask Christina why you wouldn't go along with that. I mean,
herd immunity is a natural phenomenon, but you want to avoid it because it comes at the cost of a lot of ill health and death. I mean, you know, we control a lot of our infections through vaccines. That's what the measles vaccine does. That's what the polio vaccine did. That's what the flu vaccine does every single year. It's not a question that we just let infections go through our communities.
But we could protect the vulnerable, and I guess we could say in the balance of risks, we haven't protected a lot of other diseases. We've made, if you like, a kind of COVID exceptionalism, where everything else has been put on the back burner whilst we try and solve or cure or isolate COVID itself.
Well, we don't yet know who the vulnerable are. Just yesterday, there was evidence given to the House of Lords on COVID about the current epidemic GPs are seeing of people who are really struggling with COVID months after they've supposedly recovered from it. There are kidney problems, heart problems, lung problems, blood clotting problems. And I just feel like this is a new disease. Are we really ready to say, actually, it's fine if everyone gets it?
And I guess that's the point, isn't it, Sunetra? When we don't know enough about a pathogen, we have to give it more time and consideration.
I think we've given this pathogen enough time and consideration. We do know who the vulnerable are. Many viral pathogens cause sequelae which last for a long time and can, unfortunately, be quite severe. So that is unfortunate, but that does not distinguish this from other viruses like flu. So we do actually have a fairly good understanding of who is vulnerable at the moment.
Can I ask you very briefly, because your views tend to go against the prevailing wind, I wonder whether you have found it tricky to talk like this. Have you been shut down in your views?
Well, certainly we've met with a lot of resistance from the academic community, and generally found it difficult to put this, what is not really even an alternative view, it's just a dimension to the debate that doesn't seem to be occurring. I mean, it seems to be that there is this sort of linear and very one-dimensional narrative going through, which is that this disease is extremely, it's deadly, that we don't know how many people are really vulnerable, and therefore we have to keep it at all costs.
Yeah, okay.
We have to make sure that it does not, that infections don't rise.
We're out of time.
And a very logical other proposition is that we do let infections rise and protect the vulnerable, and that's just simply not being discussed.
I'm so sorry to cut you short, both of you. We're out of time, but thank you very much for joining us. That is it for tonight. We'll be back on Friday. See you then.